Pelvic floor disorders, PFDs, encompass a wide range of conditions affecting the pelvic floor muscles, ligaments, and connective tissues. These disorders can significantly impact an individual's quality of life, causing symptoms such as pelvic pain, urinary incontinence, fecal incontinence, and sexual dysfunction. Diagnosis and management of PFDs require a comprehensive understanding of the underlying anatomy, risk factors, and available treatment options. Anatomy of the pelvic floor. The pelvic floor is a complex structure composed of muscles, ligaments, and fascia that support the pelvic organs, including the bladder, uterus, and rectum. Key components of the pelvic floor include the levator ani muscles, coccygeus muscles, and connective tissues such as the puborectalis muscle and perineal body. Dysfunction of these structures can lead to various pelvic floor disorders. Diagnosis of pelvic floor disorders. The diagnosis of pelvic floor disorders typically begins with a thorough medical history and physical examination. Patients may undergo additional tests and assessments to evaluate specific symptoms and identify underlying causes. Diagnostic modalities commonly used in the evaluation of PFDs include pelvic examination. A pelvic examination allows healthcare providers to assess the tone, strength, and coordination of the pelvic floor muscles. It can also help identify any anatomical abnormalities or signs of prolapse. Urodynamic testing. Urodynamic testing measures bladder function and can help diagnose conditions such as urinary incontinence and bladder dysfunction. This may include cystometry, uroflowmetry, and pressure flow studies. Imaging studies. Imaging modalities such as ultrasound, magnetic resonance imaging, MRI, and fluoroscopy may be used to visualize the pelvic organs and assess for structural abnormalities or pelvic floor dysfunction. Anorectal manometry. Anorectal manometry evaluates rectal and anal sphincter function, making it useful in diagnosing fecal incontinence and other anorectal disorders. Electromyography, EMG. EMG measures the electrical activity of pelvic floor muscles and can aid in the assessment of neuromuscular function. Management of pelvic floor disorders. The management of pelvic floor disorders is tailored to the specific needs and symptoms of each individual patient. Treatment strategies may include conservative measures, behavioral modifications, pelvic floor exercises, medications, and surgical interventions. The goals of treatment are to alleviate symptoms, improve quality of life, and restore pelvic floor function. Conservative management. Lifestyle modifications. Dietary changes, weight management, and fluid intake management can help alleviate symptoms of pelvic floor disorders, such as urinary and fecal incontinence. Pelvic floor physical therapy. Pelvic floor exercises, biofeedback, and manual therapy techniques can strengthen pelvic floor muscles and improve muscle coordination and control. Bowel and bladder training. Scheduled voiding and bowel habits can help manage urinary and fecal incontinence by promoting regular and controlled elimination. Pessary use. A pessary is a device inserted into the vagina to support pelvic organs and alleviate symptoms of pelvic organ prolapse. Pharmacological interventions. Medications. Pharmacotherapy may be used to manage symptoms such as overactive bladder, urinary urgency, and bowel dysfunction. This may include anticholinergic drugs, alpha-adrenergic agonists, and laxatives. Surgical interventions. Pelvic organ prolapse repair. Surgical procedures such as pelvic reconstructive surgery may be performed to repair pelvic organ prolapse and restore normal anatomy. Sphincter repair. For individuals with fecal incontinence due to sphincter dysfunction, Surgical repair or augmentation of the anal sphincter may be necessary. Neuromodulation. Sacral nerve stimulation or other neuromodulatory techniques can be used to manage refractory cases of urinary and fecal incontinence by modulating nerve activity. Complementary and alternative therapies. Acupuncture, yoga, and mindfulness-based therapies may offer additional benefits in managing pelvic floor disorders by reducing pain, stress, and muscle tension. Conclusion. Pelvic floor disorders represent a significant healthcare burden, affecting individuals of all ages and genders. Early diagnosis and comprehensive management are essential for improving outcomes and enhancing quality of life in affected individuals. A multidisciplinary approach involving healthcare providers from various specialties, including urology, gynecology, colorectal surgery, and physical therapy, is crucial for the effective management of pelvic floor disorders. By employing a combination of conservative measures, pharmacotherapy, and surgical interventions, healthcare providers can address the diverse needs of patients with pelvic floor dysfunction and optimize their long-term outcomes. Additionally, ongoing research into novel diagnostic techniques and treatment modalities holds promise for further advancements in the field of pelvic floor disorders management.